Selamat sejahtera kawan-kawan. Have you registered for your COVID vaccine yet? Or do you still have some doubts, some questions? I'm Dr. Han and I have compiled a list of frequently asked questions, and let's dive into it after the intro. Is the vaccine rushed and unsafe? Yes, the vaccines have been developed in a very short time relatively. But you have to know that this is an unprecedented and emergency situation which demands an emergency response. The scientific community worldwide has invested a huge amount in terms of funding and manpower. Also, there were tens of thousands of volunteers were involved in the clinical trials before the vaccines were developed and declared safe. COVID-19 virus is in a family of coronavirus. The researchers have had time to study the virus for more than a decade through other outbreaks of coronavirus like MERS and SARS. This mRNA technology is also not new. It has been going on for more than a decade. So this is not something that popped up just yesterday. But the media keeps showing us there are people dying from the COVID vaccine. Yes, the truth is this kind of news is actually very tasty. The media love to report it, you love to read it, and you love to share it, right? But in reality, the statistics have shown that in the US, there are about 50 reports of anaphylactic shock with more than 10 million doses of vaccines given. And in the UK, there are around 130 reports of anaphylactic shock with more than 7 million doses of vaccines given. So that comes down to 0.000005 to 0.0018% risk of anaphylactic shock. And most of the patients, they recovered after getting medical care in the hospital. So actually, the occurrence is really low. Doctor, what is anaphylactic shock? Anaphylactic shock or anaphylaxis reaction can be a severe side effect of COVID vaccine. You may get mental confusion, facial swelling, throat swelling, wheezing, hives, difficulty in breathing, weakness or dizziness, blue skin, rapid or abnormal heart rate, and low blood pressure. But remember, this is very rare. So what is the solution to this? Anaphylaxis reaction usually occurs within 15 to 20 minutes after the exposure. So, after the vaccination, you should remain in the clinic for at least 30 minutes. After that, if you feel fine, then you can leave. Touch wood, if I don't get anaphylactic shock, how would I normally feel after a vaccine shot? You may experience pain, redness, and swelling at your injection site. Some other common side effects are fever, headache, and muscle ache, especially after the second dose. If you are affected, just take some paracetamol, Panadol, 1 to 2 tablets every 4 to 6 hours until the symptoms subside. If the symptoms persist for more than a few days, please go see a doctor. So vaccination is like martial art training. We are bound to get some side effects, but this is a good sign that the vaccine is actually working our immunity system. So when our training is complete, we have a better chance when we are facing the real virus. If you are getting value so far, consider subscribing to Gigi Han channel where we talk about dentistry, general health, and everything else. It will be awesome if you can like this video and share it to your social media so your friends can also have the correct awareness regarding the COVID vaccine. Let's get to the next question. Why are pregnant women and children not included in the vaccination program? This is not because the vaccines are bad for them, but when the vaccines are being developed, the clinical trials did not include pregnant women and children. So we don't have enough safety data of the vaccine on them. Actually, pregnant women may have higher risk of developing worse symptoms or even preterm birth if they actually contract the COVID virus. So hopefully when we slowly get more and more safety data, we can include them in the vaccination program as well. It depends on the policy decision of the government. So how do we protect the pregnant women and children? We can protect them by having the majority of us getting vaccinated and developing what we call the herd immunity, where most of us are immune to the virus, and this is how we can protect them. Who should not take the vaccine? The first group of people are actually immunosuppressed patients with very low immunity. When I say low immunity, I don't mean you get flu, you get cough, you get fever easily, that kind of low immunity, but actually, for example, those patients who has undergone organ transplant for the past 3 months and they are on medication to reduce or suppress their immunity, that kind of patient. The second group of people are actually cancer patients who are undergoing chemotherapy or immunotherapy, and they have to complete their therapy cycle and then they consult their specialist whether or not they are fit to receive the vaccine. I have a history of allergy towards a particular food or medication. Should I take the vaccine? If you had a history of mild allergic reaction towards any food or medication, like itchiness, redness, or swelling, then yes, you can take the vaccine, no problem. But if you had a history of severe allergic reaction towards any injectable medication or other vaccines, yes, you can still take the COVID vaccine, but please inform the personnel and also please ensure after the vaccination you are in the setting where there are enough personnel, equipment and supplies to manage any anaphylaxis reaction if it occurs, and you have to be under observation for at least 30 minutes or more. I have a history of chronic illnesses like hypertension, diabetes, high cholesterol, anemia, epilepsy and so on. Can I take the vaccine? Yes, you should take the vaccine because patients with chronic illnesses generally have higher risk of developing severe COVID symptoms. So you should prioritize yourself to get and registered for the COVID vaccine. If you're still in doubt, do consult your specialist. Do recovered COVID patients need to be vaccinated? Yes, you may have gotten antibodies from actually contracting COVID-19 infection, but sometimes the viral load from the infection is so high that it prevents the body from forming proper antibodies. While vaccines, they provide an optimal dose of viral protein or mRNA for the body to have greater immune response and generate more immunity compared to an infection. So please get yourself registered. If you get approved, get yourself vaccinated because you can still benefit from the vaccine. Do we still need to follow SOP like social distancing and wearing face masks after vaccination? Yes, because unfortunately not everybody who got vaccinated will develop sterilizing immunity. Sterilizing immunity means the antibody will attack each and every virus, COVID virus in your body and destroy them. Some may still get the infection, get the virus, but without any symptoms, and having the virus in their body and having the risk of spreading the virus to other people. So before we achieve herd immunity, we still need to mask up and keep our social distancing. Still need to follow SOP. Let others vaccinate. then I can enjoy the benefit without getting vaccinated. Aiyo, so selfish. Bro, it's all about breaking the chain. It's not just about yourself, but also the people around you, including our children. Hey, I heard the vaccine can cause autism. Vaccine got pig DNA or not?